Today, we're diving into the world of hearing loss, but we're going to do it by looking at two very different human stories. We'll see how, for one person, a sudden change is a flat out medical emergency, while for another, a slow fade presents a completely different kind of challenge. Okay, just imagine this for a second. You go to bed, everything's totally normal. You wake up, and it's like someone turned the volume knob way down on one side of your world. Everything sounds muffled, like you've got cotton in your ear. It's not something that happened over months, it's a sudden, really jarring shift. And that experience? That brings us right to our first case. We're going to talk about MSM, a woman whose completely normal day was just abruptly interrupted by silence. So, Miss M is 34 years old, and her story starts with something that sounds pretty minor, right? A feeling of fullness in her right ear. You know, the kind of thing you might just brush off. But for her, throughout the day, that feeling got worse, and the hearing in that ear just started to fade away. No pain, no big accident, just this quiet, steady decline. Medically, what she was experiencing is called sudden sensory neural hearing loss, or SSNH for short. And that word, sensory neural, is really the key here. Just think of it in two parts. Sensory for the tiny, delicate sensory cells way inside your inner ear, and neural for the nerve that zaps sound signals up to your brain. So this isn't an earwax problem. This is a problem deep inside with the actual hardware that lets you hear. And it happens fast, a serious drop in hearing in less than 72 hours. And to put that number, 30 decibels, into perspective, it's a huge deal. A 30 decibel drop means a sound that used to be as clear as someone talking to you now sounds as faint as a whisper. I mean, that is a massive change in how you perceive the world around you. So, naturally, when Miss M arrives at a clinic, the big flashing question for her doctors is, what is going on? What could possibly cause the body's sound system to just suddenly go on the fritz like this? And you can see just how complex this is when you look at all the potential culprits. I mean, the list is long. It could be anything from a virus, to a reaction to a drug, to something much more serious like a tiny stroke affecting the ear, an autoimmune condition, or even a tumor. But here's the kicker. Most of the time, they never find the exact cause. Doctors call that idiopathic. So how do doctors even start their detective work? Well, often, it's with these two remarkably simple, kind of old-school tools. The Weber and Rene tests use a tuning fork to help figure out what kind of hearing loss we're dealing with. Is it a blockage problem, or is it a nerve problem? And for the results were pretty clear-cut. In that Weber test, the buzzing sound was way louder in her good ear, her left ear. Right away, that points directly to a nerve-related or sensory neural issue in her right ear. And the Rene test backed that up. These simple little tests gave the doctors a very clear direction. With that information, boom, the diagnosis is clear, right-sided sensory neural hearing loss. And the next step is just as clear, urgent treatment. This is considered a medical emergency because there's a real race against the clock. The inner ear is incredibly delicate, and the goal is to get in there, reduce whatever inflammation is happening, and try to restore function before the damage becomes permanent. The goal is to get treatment started, ideally within 2 weeks of when the symptoms first appeared. The go-to therapy? Steroids. High-dose steroids, which can be given as pills or sometimes even injected directly through the eardrum into the middle ear. And at the exact same time, an urgent referral goes out to an ear, nose, and throat specialist. Okay, now let's just pivot completely. We've seen this sudden crisis with MSM. Now let's turn to Mr. J, whose experience is way more common, but just as life-changing. His story is one of a slow, gradual fade. Mr. J is 74. He didn't have a sudden event. Instead, for the last couple of years, he's just found himself struggling. He can't follow the conversation when he's out to dinner with his family. He's always asking people to speak up or repeat themselves. For him, the world is slowly becoming less clear, not quieter all at once. This condition has a name. It's called presbycusis, which is really just the medical term for age-related hearing loss. And unlike Mrs. M's case, this is typically progressive, meaning it slowly gets worse over time, and it's bilateral, affecting both ears. It's actually that same sensory neural problem, but it's playing out over years instead of days. And if you're thinking this sounds familiar, well, just look at this number. Over 65%, that's nearly 2 out of every 3 adults over the age of 71, have some kind of age-related hearing loss. So this isn't some rare thing. For many, it's just an expected part of getting older. And this slide just lays it all out, doesn't it? For you have a sudden event. In one ear, it's a medical emergency, and the treatment is aggressive with steroids. For Mr. J, it's a gradual process in both ears. It's not a medical emergency in the same way, but it's a huge quality of life issue, and the management is all about amplification, like hearing aids, to keep him connected to the world. Now, there is one symptom that often shows up in both of these stories, whether the hearing loss is sudden or gradual, and that is that persistent phantom sound in the ears. Let's talk for a minute about tinnitus. So what is tinnitus? Well, it's the perception of sound when there is no actual sound happening outside your body. It's that sound that nobody else can hear. It might be a high-pitched ring, a low buzz, a hiss. It can be anything. And it's incredibly common, especially for people who have some hearing loss. Now, while most tinnitus is, well, just annoying, there are some serious red flags to watch out for. If your tinnitus is pulsing, like in time with your heartbeat, or if it comes along with dizziness, weakness, numbness, or pain, that's a sign you need to get a medical evaluation, and urgently, to rule out something more serious going on. So, we've looked at the what and the how, but let's finish up with the most important part, the why. Why is it so critical to pay attention to our hearing health, especially that slow, gradual, age-related kind? Because the impact goes so far beyond just missing a few words in a conversation. Think about it. When your brain is constantly straining all day long just to hear and decode muffled sounds, it's working overtime. That cognitive load is exhausting, and it's why researchers now see this strong link between untreated hearing loss and cognitive decline. It causes people to pull back from social events, which can lead to isolation, loneliness, and even depression. It really touches every single part of a person's life. So, what are the big takeaways here? First, your hearing is a vital sign of your overall health. It's not just an afterthought. Second, please don't ignore changes, whether they happen overnight or over a few years. The absolute essential first step is to get a professional evaluation. And finally, just remember that there are so many effective options out there now, from incredible hearing aids to all sorts of other helpful devices. And we'll leave you with this one final thought. Our sense of hearing is one of our most fundamental connections to the people we love and the world around us. So take a moment and just listen. What is your hearing trying to tell you?